Petrie, thank you so much for your time. I mean, this is quite important because even though we've, heard the calls from government to continue, complying with lockdown restrictions and wearing our masks when we go shopping or leaving our homes, it seems there might be confusion in thinking that all cloth masks are good masks, or they will do the job in terms of prohibiting one from contracting COVID-19.
So there's definitely a lot of misinformation in the air regarding the topic of masks. And I think for starters, masks is a great way for individuals to take some responsibility for their own well-being, as well as helping to curb the spread of COVID-19 to others as well. And because we are faced with these shortages of PPE in the medical sector, cloth masks become an excellent solution for the public sector to also have access to at least some kind of mask.
And then now take me through the different types of masks. I mean, I've been seeing masks where people would make for themselves at home. Some people use their scarves. I've seen, the blue-like masks. Some look, they almost feel very hard. Some, the material is quite soft. And I tend to be confused as to when using a cloth mask, which exactly is the right one to use.
Okay, so firstly, the blue mask you described, those are typically our surgical face masks from the medical sector. And generally, most government bodies recommend that medical surgical face masks and the N95 face masks be left for those working in the healthcare sector. But when it comes to our cloth face masks, so a lot of different materials are being used, and not all of them will necessarily filter virus equally well. So like the scarf you mentioned, for example, we do have some data, and scarves tend to be a very coarse woven fabric, so they aren't the best filters. Better household materials to use for filters, something like a tea towel maybe, or your cotton blends, also tend to work very, very well.
So when you go and purchase perhaps a cloth mask, because I've also been seeing some designers and retailers being quite creative with the selling of cloth masks, I mean, what do you say to them before purchasing a mask for yourself?
Okay, so one of the first aspects when it comes to masks is determining the actual fit of the mask on your face. So a mask can do one of two things. It can either catch some of the droplets that are coming from you, so we refer to that as source control. So that makes you, if you are infectious, it makes you less so to those around you, which is the primary aim of trying to spread cloth masks throughout the population. To expect your cloth mask to provide you with protection is a little bit more tricky. Now we need to start thinking about not only the material you choose, but the seal of the fit on your face. So when it comes to buying a mask, you can consider how well it fits on your face. The fabric itself is quite important, multiple layers of fabric as well. And now we're seeing some recommendations, even including the mask having almost a slot for a filter to go in as well.
Yeah, and Petrie, just before I let you go, I mean, you are a medical doctor and you are at the front line of, sort of dealing and addressing, challenges around COVID-19. When, patients come through to a healthcare facility, are we seeing more of them wearing their mask? Are we seeing more compliance in wearing the right mask, but also observing lockdown regulations? So to make your job as healthcare workers a lot more easier and a lot less at risk.
So I can only speak from my point of view here in Pretoria, but for the most part in my community, we definitely have seen fairly reasonable lockdown adherence. And initially, the uptake of cloth masks was very, very slow. But nowadays, for the past week at least, I think the vast majority, if not all our patients, do arrive wearing some kind of cloth mask. And then for those who are showing some signs of suspected COVID, we do provide them with masks as well. So at the end of the day, virtually everyone inside the hospital is masked up.
All right then. Well, Petrie Jansen van Vuuren, thank you so much for talking to us. That's a medical doctor there, just warning South Africans to ensure that in as much as government has advised to wear cloth masks and leave their N95 and more surgical masks for the frontline healthcare workers, ensure that it is the right material, ensure that it will do the job when it comes to preventing, of course, any droplets that may land on your face and thus having you contract COVID-19.